In this video, I'm going to talk about airborne infection isolation rooms. In healthcare facilities, you'll have a patient that is either immunocompromised, where you would want a positive isolation room, or they have an infectious disease, in this case, which you would want a negative pressure isolation room. Basically, we want to keep whatever infectious disease is in that patient room there and not getting into general population areas or um, staff corridors, anything like that. We want to keep it isolated to just that patient room. So the airflow supplied to this room has to be balanced with the exhaust airflow to create a negative differential pressure with respect to the adjacent space. The exhaust from these rooms is not recirculated into the HVAC system. Instead, it exhausts uh, direct to outside air where the atmosphere can provide sufficient dilution to make the resulting air safe. So, first and foremost, these rooms are designed with the guidelines set forth in the ASHRAE Standard 170, which specifies what the air change rates have to be, pressure requirements have to be, temperature, and filtration conditions. So on the left-hand side of the screen, I did share what the CFM formula is, and that is the volume of the room times the air changes per hour that ASHRAE dictates, and then divide that by 60, gets you your CFM supply. So over here we have 400 CFM. So we've got a constant fresh air supply here that's getting climate controlled by the coil within the constant volume box. It goes across a set of filters that filters the air. An important factor of that supply diffuser is above the patient, so that air is passing over the patient first. So we have 400 CFM. So basically, if we did want to figure out where they got that math, we have the dimensions of this room. We could work the math backwards in the formula to get to that. But the standard is calling for 12 air changes per hour. So that room's air needs to be changed over about every 5 minutes or so. So going back to it, the negative pressure has to be greater than the incoming air. So over here we have 400 CFM coming into that space, and then if we look over here, we can track where that airflow is going. So for instance, we've got a return register here that's taking 300 of that, 300 CFM off of that. And then in the bathroom here, we have 60 CFM. So that gives us a remaining 40 CFM that passes underneath the door to the anteroom here. So there's also, they have listed the 10 air changes per hour. That's for the bathroom, and 10 air changes per hour for the anteroom. So what the anteroom's purpose is to allow a control of that patient room by having two sets of doors to get into that space, so that there's a buffer room here to help keep that infectious disease or bacteria within that room as best that they are able. All right, so if we look at this return grill in the anteroom here, we are pulling 40 CFM underneath the door, and then we have a return fan that's balanced to 140 CFM. So that is going to draw 100 CFM from out in this corridor, and it's going to be constantly pulling that air from the corridor in. So if we watch how much air we're pushing into this room, we are always drawing more out of it than we are adding to it, which helps protect, like I said, the general population areas and nursing staff areas to keep that isolated to that room. So in order to monitor and make sure that when these rooms are occupied, there are pressure monitors here that will have sensors on either side of this wall, and that will be keeping an eye on the pressure differential between the two spaces. So we'll have one here, which is anteroom to the isolation room, and you'll have another pressure monitor that's from general population area into that anteroom as well. So those will be constantly taking readings, and those will go out to a pressure monitor that will be a visual screen out in the corridor for nursing staff, so that you can visually see what the air changes per hour are and what the pressure differential is. So there will be, if that anteroom was to be open while this bed was occupied for too long, there would be an audible alarm on that pressure monitor that would alert the staff to make sure that the doors get shut. And if it goes on for a set amount of time, the building management system, if it's in place, would also pick that up and alert facility staff that these doors were left open as well. So it's very important that that there is training that goes along with this for the staff that work here in these healthcare facilities with these pressure monitors, that they are keeping an eye on the ins and outs going into these isolation rooms to help keep everybody outside of those rooms safe. So there is quite a bit of controls that goes into making sure that that stays the same. So just to recap, we are bringing 400 CFM in, and we are taking 400 CFM out of that room with a little extra, pulling 100 CFM from the outside corridor. So it helps prevent any infectious diseases from getting out of that space. Now, the design of this is good, but it's only as good as the maintenance taking care of the facility and making sure that there's constant airflow going in, and that these exhaust fans are always operating properly, and that the pressure monitors are working properly as well. So it takes training of facility staff as well as the healthcare staff to make sure that this is maintained properly and utilized correctly. If you enjoyed this video, I'd encourage you to subscribe to my channel. Thank you.